This is the InstaClinic of Dr. Wasim. Please be advised that some medical imagery may be unsuitable for young viewers. The doctor will see you now.
This week's InstaClinic comes to you from Knightsbridge from the Dr. Rita Rakers Clinic. Dr. Rita Rakers has been in the aesthetic industry for over 25 years, and she really is the go-to person for all things machines. She has the biggest range of them, she's the most knowledgeable in them, and she's a global ambassador for most of them, so she really is the person that we want to be talking to. So if you have any questions about radio frequency, ultrasound-based devices, ab crunching devices, butt lifting devices, pelvic floor tightening devices, anything, this is the chance to ask them. Over to Rita.
Thank you, Wasim. So excited to be on the InstaClinic today to explore various treatments for face and body with cutting-edge technology. As you know, I visit all my esteemed colleagues around the world and attend various conferences to look at the latest machines that can provide the best results. Over to the questions.
So our first questions are about a machine called BTL Emsella. This is a machine that is a great option for women of any age who desire a solution for urinary incontinence and to improve their quality of life. Body aging, childbirth, menopause, they can all lead to incontinence, and the pelvic floor's muscles become insufficient to support the pelvic organs and they affect your bladder control. BTL Emsella chair effectively stimulates pelvic floor muscles. Are the results of the Emsella chair permanent, and how often would I need to repeat the treatment if not?
There's no treatment that's permanent, even surgery. Most of my patients will have a top-up at around 12 months. It also depends on how your symptoms are. If they're slowly starting to come back, you can have a top-up. Or of course, if you've had a baby in the 12 months, you'd obviously need a top-up. So we usually do a course of treatments and then reassess at around 12 months.
Can you use the Emsella chair? Can you use the Emsella chair if you have a coil?
As Emsella is new MRI technology, any metal in the area you can't have a treatment, and that would include a coil implant. We do have a lot of our ladies actually use the opportunity to change their coils, have the course of treatment, then come and have a new coil put in. You usually have to wait about 6 weeks after the last treatment to see the full result, but many of our patients feel a difference already after the first or second treatment.
Dr. Rakers, can't boys do this too?
Dr. Wasim, can you get off my Emsella chair? Because we've got ladies queued up round the corner. However, it is a very beneficial treatment for men because it increases the blood flow in the area. It's also with obvious side effects. And also it's very good if you have prostate problems. It will reduce the number of times you have to get up in the night for gentlemen. But this also works for women. So even if you haven't got a pelvic floor situation, as you get older, you do tend to have a tendency to get up through the night, and this will reduce dramatically and get a good night's sleep.
Question: what will get rid of my turkey neck?
Yes, we do not want to have a turkey neck before Christmas. So our cornerstone treatment for doing turkey neck is the Ultracell, which is radio frequency and ultrasound. It gives you a nice tightening. We also give you a bit of Pellevé with it, which is a fast radio frequency tightening while the Ultracell is kicking in over 3 months. We also do some Profilo. You can do a little bit of Botox as well. And then of course we've got our various treatments such as the Dr. Levy Stem Cell Booster Cream. I've got a new neck lift cream. So we find with turkey neck, it's often good to have a combination.
Next question. Is there a difference between Ultracell and Ultherapy?
Okay, there's a lot of confusion with the different machines. Originally there was Thermarge, which is radio frequency, and we're the second biggest in the world. Then there was Ultherapy, which was ultrasound, but as we all know, that was very painful, although we did a lot of treatments and got a lot of awards. Now Ultracell is the newer treatment. You get a radio frequency treatment and an ultrasound treatment. It also lasts about 2 or 3 years. But the beauty of it, it isn't painful. And besides that, you don't get bruising, redness, swelling, query nerve damage, fat loss. And if you want to compare them, because these treatments started about 15 years ago or maybe 20 years ago, it's like iPhone 2 or 3, and the Ultracell's more like iPhone 9 or 10 now.
So here I am getting ready for Ultracell. Ultracell is a machine that goes down to the same level of the skin that plastic surgeons use to tighten and lift faces in a facelift. I'm here with Dr. Marco. Dr. Marco, is this going to hurt? That's looking quite scary.
No, it doesn't hurt at all.
Are you sure?
Yes, I'm sure.
Right, and if I was going to have this treatment, Dr. Marco, how long would it take for it to typically show a result?
Up to 3 months, so it's a gradual improvement, and generally after 4 to 6 weeks you start to notice something.
And there's something quite cool about this machine. I remember you telling me that it also has something called radio frequency in it. Yeah. That's different, isn't it? Because that sort of fixes the upper layers of the skin, not so deep. What can you tell us about radio frequency? Is that permanent? Is it painful?
No, it's not painful. You feel just heat, and basically it's a double action, so you have a better result with this technology because you have 2 energies in one treatment.
All right, I'm going to stop talking. Let's start. Next question. What will get rid of my saggy knees? I refuse to wear short skirts.
Saggy knees. Now, this is a problem as you get a little older, and also if you've had a bit too much sun damage because the collagen's been destroyed. So first of all, as a preventive, please remember to put sunblock on your knees from an early age. Then we've got radio frequency, which will tighten you, and it does help if you do the whole front of the knee and the front of the thigh and pull up. Then we've got various new products such as AQ Skin Solutions, and there's a new product that also helps with the crepey knees that's just going to be launched at CCR. And then of course you can have a little bit of micro needling as well, and the Dr. Levy Stem Cell Booster Cream. So again, saggy knees can be difficult, but we have an armory of treatments.
Is there a specific machine I can use for my abdominal skin after pregnancy?
Oh yes, the mummy tummy. So we have various machines. One is our Ultracell, which will tighten your skin. And then if you want a fast result, we do a little bit of Pelotherm. Then we also have the new Emsculpt, where I'm the global ambassador, and that will tighten your muscle, help as well with any diastasis recti where the muscle's separated, and burn any little bit of fat. And that's sort of our usual combination for the mummy tummy.
And we have time for one very last question. And the question is, what is Emsculpt? You guys have been talking about it. Can you explain it some more?
We have this new exciting MRI technology, the first treatment in the world that can give you stronger abs in 4 to 6 treatments, and also melt fat at the same time. Not only will it do your abs, but now your bottom, and the new paddles for the arms and inner thighs. Very exciting, from the global ambassador, Dr. Rita.
And that's it. That's the end of this week's InstaClinic. I hope you enjoyed watching it. A massive thank you to Dr. Rita Oreikos for taking the time to answer our questions today. We were both running some very, very busy clinics, and it was quite a feat, but we did it. I hope you've enjoyed watching. Thank you for sending in your questions. I'm sorry we couldn't answer all of them. If any of the information that we didn't make sense, give me a shout or message Dr. Rita Oreikos' account also, and we will happily clarify that for you. Again, I hope you enjoyed watching. Thank you, and stay tuned. I have some really, really exciting guests coming up in the next 3 weeks.